I like working with people, and the best part of medicine is working with people and building relationships. I have a background in internal medicine. I've done some form of primary care for 12 years plus in my career. I have a certification in lifestyle medicine, and I've worked for the past 11 years in the field of men's health. Having a background in internal medicine and in lifestyle medicine gives me a different perspective. I see primarily patients within the Department of Urology, but I'm more inclined to take a 360-degree view of a patient's health. When they come in the door, they want to feel better, they want to have improved quality of life, and they may want to do things to live longer. Men frequently don't go to the doctor the same way that women do, but they will come to the doctor for a male-specific complaint. And so they may come in the door with a concern about erectile dysfunction. It leads to cardiovascular risk assessment, and then really important conversations about their diet or about their level of physical activity, screening for sleep disorders, management of stress. Young men who come in with a concern about fertility, about sexual function, perhaps about low testosterone. It could be older men who have some concerns about screening for prostate cancer, or they may be survivors of prostate cancer. They've gone through treatment, and now they're experiencing some of the complications or side effects of that treatment. So it's young, middle-aged, older men. It is really comprehensive. My goal in my practice is to understand each patient's individual goals for their health, and it's always different. I spend a lot of time getting to know them, getting to understand their life outside of the office. And in that way, after that connection is made and we sort of collaborate together on goals for treatment and map out their journey to better health. The evaluations that I do are sometimes referred to as a cardiometabolic evaluation. I will do a basic physical exam, biometric screening, checking height, weight, waist circumference, blood pressure. There are very specific evaluations that we do for conditions like Peyronie's disease or for erectile dysfunction. They may need very specific types of imaging to diagnose their problem. As far as treatments go, I do a lot of, my practice involves a lot of testosterone therapy. That can be self-administered treatments that men do at home. They may come into the office and do a treatment, whether it is spending time with their grandkids, whether it's being able to dance at their child's wedding. We collaborate together, and that motivation helps them to achieve the health outcomes that they desire. The most satisfying thing for me is to empower people to make changes in their day-to-day life to be healthier, so that they're not dependent on a pill or a procedure to stay healthy.